Good morning, everyone. Uh,
Morning.
Today I'm giving you another COVID-19 update. As you know, a year and a half ago, there was one cough and the entire world changed. Certainly my world changed in many ways, and I'm sure that yours also did. One of the ways it changed was I started giving presentations on COVID. And so far, I've given 32 presentations, some in English, some in Spanish, to 7 Rotary clubs as far as Kampala, Uganda. They are on the club website, some of them, and some of them are on YouTube, and you can find them under my name. So this is a presentation that I gave to the club in Kampala, Uganda. Now, let me say that the National Library of Medicine in Washington, D.C. Compiles all publications, all scientific publications, and lists them, and you can access their listings on your computer simply going to pubmed.gov. And I have been curious to see how many publications there are on COVID-19. And as of January 2020, there were 0 publications. I looked it up again yesterday, and there are now 145,651 publications. This is how fast the scientific literature has been growing on this subject. The death toll in the USA to date has reached 600,000. But importantly, we now have vaccines. And should everyone get vaccines? That's an easy answer. Yes, of course. It's very important. They are effective, they are available, and everyone should get their vaccine. There are 3 that are authorized by the FDA, as you know, Pfizer's BioNTech vaccine and Moderna's. Both of those are mRNA vaccines. And then there's the Janssen J&J vaccine. It's a little bit different, and it's also a single shot vaccine. But most of the people vaccinated in the US have had the first 2. Coming soon, Oxford, AstraZeneca, Novavax, and other vaccines. And of course, I am not mentioning some of the international vaccines like the Russian vaccine called Sputnik, and others from China like Sinovac and CanSino and others. One issue has been, should one get 1 shot or 2 shots? If is 1 shot of the Pfizer or 1 shot of the Moderna vaccine enough? People ask themselves that, particularly if they've had some reactions and don't want to get a second shot and have the same reactions or worse. And the answer is yes, you should get 2 shots because there's a remarkable 4 to 6-fold increase in the number of antibodies that you develop following the second shot. So the first shot is not enough. You need to get the second shot. Easy answer to that. So here we are with all of those vaccines available. We continue fighting the virus. And what is the percent of fully vaccinated individuals? That is, people who have received 2 shots to date. Only 44%. Only 44% of our population has received both shots of the vaccine. Percent that has received at least 1 shot, 52.7%. You hear figures that make you believe that that should be much higher, but this is real life. This is what it is. On the other hand, the effect of at least 40% of us having received both shots of the vaccine is remarkable, as you see from what's happening with new cases over time. There's been a remarkable decrease in new cases since back in December, the last 6 months, remarkable decrease in the number of new cases reported on a daily basis. However, the number of vaccines administered to date is an impressive 312 million doses of the vaccine. But you have to divide that by 2 to understand how many actually got vaccinated. So it's about 155,000. I'm sorry, 155 million people. So that's not even half of our population. That's where the 40% comes from. And vaccinations, people got really interested in getting vaccinated. A lot of people got immunized, and then it's declined. It's declined and continues to decline. The interest in getting vaccines and the hardcore people who are out there saying, I'm not going to get the vaccine, is showing in terms of what the curve is doing. Sadly, over 100 million Americans remain unvaccinated, and I'm telling you, is well over 100 million Americans. And they themselves are at high risk, and they're putting others at high risk, and we'll go into the reasons why this is happening. Everyone should get the vaccine. It's simple, it's available. There are some reactions. Not everybody gets a reaction. In my family of 14 of us, only 1 got a serious reaction, and we all had either Pfizer or Moderna. And then the question of, should we wear masks or not? Masks or no masks? That is the question. And this came to an important point in May, because the CDC felt that they had to issue a guidance, given that the vaccines were working so well, a new guidance in May of 2021. And they did this through the director of the CDC, Dr. Rochelle Walensky, and I think we need to understand who she is and where she's coming from. This lady has an impressive CV. She has a master's in public health from Harvard, a doctor of medicine from Johns Hopkins, a Bachelor of Arts from Washington University. She has served as advisor to the WHO and the UN program on HIV. She is chair-elect of the HIV Medical Association. She's a past chair of the AIDS Research Advisory Council. She is a professor of medicine at Harvard, and she is the chief of infectious diseases at Mass General Hospital. She is the 19th director of the Center for Communicable Diseases. As such, she sits right here in this organizational chart. And she has over 11,000 employees reporting to her in terms of also advisory and other committees. Now, for vaccines, it's actually the Deputy Director for Infectious Diseases who heads this group, where most of the action plans and recommendations originate. They go then through the Chief Medical Officer and through the Chief of Staff to the Office of the Director. That's how they get to Dr. Walensky. She in turn reports to the Health and Human Services and then to the President. What was the information at hand as of May of 2021? First of all, in terms of vaccine protection, from studies conducted by Pfizer and Moderna have shown that the vaccines, one dose will protect you 52%. The efficacy in protecting you from symptomatic disease is 52%. 2 doses, the efficacy is 95%. So as I said, a significant difference because of the great increase in antibodies, 4 to 6-fold as many antibodies after the second dose. Important to get that second dose. And protection from serious COVID, meaning hospitalization and or death, is 90% or better. In terms of death, it's approximately 100%. Now, there was a recent study, and this is a large study of close to 10,000 persons were checked for PCR. And the ones that were PCR positive were sorted into vaccinated or unvaccinated. The ones who were vaccinated and were tested by PCR, 1% turned out to be positive. The ones that were unvaccinated, 4% turned out to be PCR positive, which means that they are probably carriers of the virus. Now, this is important for a number of reasons. First of all, as you see, even when vaccinated, you can carry the virus. You can have the virus in your nose, throat, upper respiratory system. You can be a carrier and pass that virus on to others, even though you're vaccinated, okay? This 1% is probably at the low end of the range. The range probably extends much higher. And I would think that as many as 5 or more times the vaccinated can be carriers of the virus. And the same goes for the unvaccinated. Of course, if they come in contact with someone who has the virus, they can get it. And they can get symptomatic or asymptomatic disease and be carriers. And I would say that this 4%, again, is an underestimate, that many of the unvaccinated can carry the virus and pass it on to you. And remember that they don't have to be symptomatic. In fact, almost 40% of people who have the virus do not develop symptoms. Do not develop symptoms, up to 40%. So you meet someone who looks perfectly normal, and he may be transmitting the virus to you. And you may be vaccinated and you can still get the virus. You may or may not get symptoms. The good news is that if you do get symptoms, it's probably going to be minor, like a minor cold. Very unlikely that you'll be sick enough to require hospitalization or die from the disease. But yes, even when vaccinated, a minority of us might get the virus. I don't want to risk it. You have to make that decision for yourself. Okay, other information available at the time in May, this is just a month ago, if you're not immunized, and have not had COVID, the chances of your being infectious to others, of transmitting the virus to others, if you have the virus, you are 100% infectious. Your estimated infectivity is 100%. Now, if you're not immunized but had COVID, then that comes down to about 20%, but you can still be infectious. Now, if that means that if you are not immunized but had COVID, so you have some immunity because you had COVID, you can still get the virus and be infectious to others. And there's a 20% chance of that. If you are immunized but had only one shot, then again, its infectivity is about 20%. If you're immunized and had two shots, then the estimated infectivity is 5%. Again, what that means is that if you're immunized and had two shots, you can still get your virus in the respiratory system. And if you get it, your chances of being infected to others is 5% probability of transmitting the virus, okay? So vaccination and all, the opportunity for person-to-person transmission is still there. The chances are much smaller than before because most of us are now vaccinated, but it can still happen. And if it does happen, you can either develop a mild case of the disease, or you may not develop any disease whatsoever. You may be totally asymptomatic, but once you get it, then you can transfer it to others. You can be infectious to others. So we still have to be careful. Now, based on all of that, the CDC came to the recommendations that I have summarized in this table. And basically, those that were not vaccinated were still asked to take all precautions in terms of wearing masks, washing your hands, maintaining social distance. But they were a little bit more liberal for those who had been vaccinated. No masks, no masks, no masks for all of these activities, but still continue using masks indoors in public when visiting the unvaccinated, in large size gatherings, etc. Those were the May recommendations by the CDC. And this is how they were a bit more liberal than before. Now, at the same time, almost, in April, and this issue of the American Medical Association is dated April, but came out a little bit later. I found about it in May, just when the CDC recommendations came out. And I believe that this article on the interim recommendations by the CDC was not something coincidental. I think it was meant to be issued at the same time as the CDC recommendations. And the author is Dr. Rochelle Walensky, the head of the CDC. And in this paper, she presents the CDC recommendations, but importantly goes into a number of disclaimers. For example, she says, fully vaccinated people can resume activities at low risk to themselves while being mindful of the potential risk of becoming infected and transmitting the virus to other people. Disclaimer. Another disclaimer, prevention measures should be maintained if unvaccinated people are at risk of severe COVID-19 or if multiple households of unvaccinated people are mixing together. The second disclaimer. Third disclaimer, continue to wear a well-fitted mask when in public or with people at risk of severe COVID, avoiding large gatherings and postponing travel. Another disclaimer, to reduce transmission, layered prevention strategies such as the universal face mask mandates and restrictions on occupancy of indoor spaces and the size of social gatherings are essential, And then she made the question, how long does protection last? We don't know. She made a statement about that. We do not know how long protection lasts. It probably lasts 6 months or more, but we don't know how much longer. Then another disclaimer, variants have dispersed across the USA, and I'll come back to that. And how well do vaccines protect against emerging variants? And she insisted on the fact that there is reduced efficacy by vaccines against this particular variant, the B.1, .1, .351 that first emerged in South Africa. So she issued all of these disclaimers just as the CDC, under her mandate, was issuing their May recommendations. And the CDC did not insist on these disclaimers. So I feel that she felt obliged to publish this in the Journal of the American Association to let people know that although the CDC, and she's the head of the CDC, was issuing certain recommendations that were liberal, there were still a number of things that we needed to be careful about. I found that to be very interesting. The head of the CDC issues recommendations, and then the head of the CDC publishes in a prestigious journal disclaimers as to those recommendations. Go figure. And then comes June. And all of a sudden, no masks. Certainly in California, June 15th, no masks. The federal government, the CDC, and the California health authorities, county, etc., all of them issue new recommendations that are more liberal as to the precautions to be taken, that they believe are justifiable because of the increase in vaccination, because a high percentage of the population has been immunized, and because there has been such a hit on our economy and on our society that it would be hard to continue to maintain all of the preventive measures that we have been using so far. So they say no masks. And they don't just say no masks. They go into no masks, but, and the but includes, okay, if you go into a hospital, if you go into a nursing home, if you go into certain social situations, if you go into meetings with a group of people exceeding X or Y number. So there are exceptions to the no masks recommendation. But how does the public take it? How does the public interpret it? Most of the public does not look at all of the fine print and all of the disclaimers and all of the exceptions. The public in general says, oh, we don't have to wear masks ever again anywhere. And everybody is burning masks, recycling masks, using them for other purposes. What changed between May and June 2021 that made us go from a certain liberalization on the use of masks and preventive measures to an open America, to an open USA, where most people believe that we have to take no precautionary measures and certainly not wear masks? Nothing significant has changed. Nothing significant has changed. Why this big change when nothing significant has changed? Because people are saying we have reached herd immunity. We are at herd immunity. We are all protected. No one is going to get infected. And they are close. They are close, but it's not reality. We are not at herd immunity. 44% of us had had 2 shots. And another percent of us has had at least 1 shot, which takes us up to 53%. That is not the 80% that we aim for when we talk about herd immunity. There's been great progress. We're far better off than we were previously, but we're not quite there yet. There's the anti-vaccine people, and many of them are hardcore, that regardless of how you present the arguments for vaccination, they will not accept them. Some of them remain that are convinced that they're being injected with a chip by the government so that the government can follow them and know where they are and what their activities are. For heaven's sakes, a government doesn't have to do that with a chip. They're doing it already with your iPhone. They're doing it through your Alexa and your Google. But anyways, I'm joking. That's estimated to be about 20% of our population. By the way, if these numbers at the end don't add up, it's because there is some overlap between groups. And then we have an estimated 30% who have had COVID. Now, many of those, even though they had COVID, have been vaccinated and have had 2 shots or at least 1 shot, which is a good thing, because even though they have had COVID, the recommendation is they do get immunized. They'll be much better off. They'll have a better assortment and a better level of antibodies and longer durations than just having COVID. Having had COVID in the sense of protection is a good thing. You do have some protection, but you need the immunization. Okay, so I think that makes my point. We are not quite here yet. If you ask me personally, my family and I are going to continue to wear masks in most public situations where groups of people are involved, particularly if we suspect that in that group of people there might be someone who's ill or at high risk. We need to protect ourselves still. We don't use masks all of the time, but we carry them. We have them with us. And if we go into a hospital or a nursing home, if we go into a game, Padres game, or, groups of people, we might wear masks. So we believe that we still need to protect ourselves and that we will be really completely safe when we reach this herd immunity. But we need these people convinced that they need to take their vaccines. So like I said, the interpretation by the public has been that we don't have to wear masks anymore. Business as usual. But my friends, the vaccine is effective, available, and very important. Vaccines do not offer full protection, but if you're vaccinated and you do get the virus, either you don't develop any symptoms at all, and if you do, they will be minor, like a cold. You will not have to be hospitalized. It's very unlikely, and you will not get severe disease. It's very unlikely. The unvaccinated can be carriers and can be infective, even to those who are vaccinated. The vaccinated, even though vaccinated, can be carriers and can be infective. There's a very small proportion of them, but it can happen. You cannot identify that person. There's no way of identifying that person unless you do a PCR. Now the variants. Some are more contagious and lead to more severe disease. Well, we're going to talk a little bit about this if time permits. If you lay out the RNA, which is usually coiled, but if you lay it out onto a very long strip, it might look something like this. And one part of the viral RNA is the one that is codified, that is programmed, that carries the instructions for the production of spike protein. Now, the entire RNA from end to end contains about 30,000 bases. And of those 30,000 bases, every time the RNA replicates itself, mutations can occur. And mutations can occur anywhere along the RNA, in any of these bases or groups of bases. If they occur in the spike protein area, they can be very important because they can affect how much protection the vaccine affords. But mutations can occur anywhere along the RNA length, and these may not be important at all. The most important that we can identify right now are the ones that affect the spike protein. And many of the variants have a number of mutations, but importantly have mutations in this area. Here's the listing of the variants that we know and that are important at this point. They have now been codified using Greek letters. So the UK variant is now called Alpha. South America is called Beta. Brazil is called Gamma. There are two variants homegrown in the USA. They're Epsilon. And then there's an important variant from India called Delta. The most prevalent variant in the US right now is the B.1.1.7 from the UK that we call Alpha. That's the one that most people in the US who currently have COVID are infected with. The one from Brazil has made some inroads and it's more aggressive. The P.1 from Brazil is also in the US, so both the South African and the UK and the South African and Brazil are in the US. But again, most prominent and most prevalent is the Alpha from the UK. More recently, this Delta variant has originated in India and has caused tremendous grief in India because it's so infectious, so aggressive, and a lot of people have been infected and unfortunately have died in India because of this Delta. Delta is now in the US, and it's estimated that about 10% of our new cases are the Delta variant. So why are the unvaccinated at greater risk? Because when we, the vaccinated, were at risk, the variants that were infecting us were the original variant that came from China, or the variant that came from the UK, but these other variants were not around. So some of us got severe disease. Many of us, unfortunately, passed away from COVID, but many fewer than had these new variants been in the US at that time. So people who are at risk today are at much greater risk because the variants that they might get infected with are more infectious, lead to more severe infection, and we're going to see more death from these variants.
Antonio, we're starting to get to the end of the meeting. Will you have time for questions, or where are you in your presentation?
I'm about done. So just to say that those that are unvaccinated, it's so important that they get the vaccine, because if they get the Delta variant, their chance of hospitalization and death is much, much greater than it was before. Alpha variant more transmissible, Delta variants, I'll skip on all of that. So if you had the vaccine, what can I do now? Personally, continue to use common sense, use the mask when you think it's necessary, use those precautions and preventive measures with good judgment. Thank you.
All right. Antonio, thank you so much for another great presentation. Do we have some questions? I know it's at 8:30, but we don't have anyone taking over the meeting after. So if there's any questions, please feel free.
Emilio,
Yeah.
one of the questions on the wearing of masks, I am assuming, to take the inference from your comments about use common sense on wearing masks, that's the answer as to I'm about to be on an airplane tomorrow flying to Hawaii. That's the reason masks are still required on airplanes. Is that a correct inference?
That's correct, Mike. I would personally wear masks. I think they're going to require them yet on airplanes.
Yeah, they do. They do.
I would take all additional precautions of taking your hand sanitizer with you, of taking some wipes, of wiping everything around your seat, being careful with what you're served. Don't take any open beverages. Wipe everything. Be very careful.
Okay, thanks.
Looks like Denny Bucko has a question.
So Tony, I've got so many questions, but just to be quick, the future, it seems to me that everything I've read is that we're going to have another big spike in the fall, no matter what. It's just so clear to me, and it's going to be bad. So I'd like your comments on that. And second, what is your present position and understanding of the origin of the virus in 25 words or less? Is it, do you think it's lab or is it zoonotic?
I think that because we have such a significant percentage of people who will not get vaccinated for one reason or another, that we will have a spike, and that unfortunately it may be a Delta spike. And Delta is highly infective. It produces more severe disease. In that particular group, we will see a higher percentage of hospitalization and deaths than in all prior groups in all our year-and-a-half experience. So I think we will see that, but specifically in that group of the unvaccinated. I'm hoping that soon we will be able to vaccinate those younger than age 12. At this point, we can vaccinate only 12 and above, but studies are being done certainly from 5 years to 12 years, and that will soon become available. And hopefully that group will be vaccinated too. Where does the virus come from? This has been so contentious and so subject to political inference and pressures and incredible influence from political sources. But if you are able to divorce yourself from all of that, you have to ask, is this coming from nature or was this a laboratory accident? And I personally think that there's a very high possibility that this was a laboratory accident. And there's a very tiny possibility that it was worse than that it was intentional. So you have to ask yourself, are we, the US, developing viruses in our government labs? Are we weaponizing those viruses? And I think the answer is yes. Yeah. We are doing that because a lot of the major countries are doing that in terms of their protection, so to speak. Does Russia have laboratories where they have smallpox, for example, or are developing viruses for bioterrorism? Of course they have. So then say, does China have such labs?
Sure.
Sure, they have those labs,
Yeah.
and they are weaponizing those viruses. Is it possible? Is there a 1 in a million, a 1 in 100,000 chance that someone in the lab might get infected and take that outside of the lab? Well, of course, it can happen. It can happen, you know.
Yeah.
It's a remote possibility, but it has to be considered. Are we going to do anything about it? Hard to prove. The Chinese are not willing to show any of their records. That's unfortunate because it would be nice to know that they've taken all precautions. So we're not going to know, I think, is the short answer.